We do, in fact, have some questions here. And, Coldup, I'm going to say get ready, because I think we're skewing in the research category here. So we're going to throw a couple your way. The first question is from the Evanses, and they ask, are people who are older tested less, or is it due to not knowing one side of the family background? And I think that's probably most appropriately directed at you.
Are people who are older tested less, or due to not knowing one side of the family background? I'm not understanding what the question is, but one of the biggest risk factor for ALS is age. And so, that, I think if you're asking about testing, I'm assuming it's genetic testing that you're asking about. It's not, it's not that they're tested less. It's really whether it's in your background or not. One of the things we're doing right now is trying to develop a genetic testing guidelines so that when you go in and get diagnosed with ALS, that there are guidelines set up around family history, around the age of diagnosis, that these guidelines help your neurologist, your general physician, your ALS specialist decide whether you should get a genetic test or not to understand if there are any ALS mutations. So it doesn't, just because it's not in your family doesn't mean you don't have the gene, and vice versa. So it is important to know that genetic status if you're able to, especially if you have a family background in it. I hope that was helpful in terms of how I answered.
Well, thank you, Coldup. And I'd say if that's not the question that was intended, feel free to ask a clarifying question in the chat, and we can come back to that. But before we have you step on the stage, Coldup, another research-focused question. This is about TDP-43. And that's research that's been active for a while now. Can you talk about where we are currently with that?
Yeah, so TDP-43 is the protein that goes dysfunctional in ALS. So over 98% of ALS patients have this abnormal protein that clumps together, what we call aggregation. And this is the protein that aggregates, TDP-43. So it's crucial that we're able to measure TDP-43, either measure it in a biofluid like blood or your spinal fluid, or if we can do it like Tim Miller is proposing to do, which is to do a PET scan and see if you can measure it that way. I think the question is TDP-43 has been studied for a long time. The problem is that it's hard to develop assays, biomarker assays against these proteins. These proteins are very abundant in our body, and only a small amount of it goes dysfunctional. So it's difficult to measure it. And so it's not the question is, we have been doing it for a long time. Yes, we have been doing it for a long time, but it's just not easy. We're not the only ones with this challenge. The Alzheimer's field had this challenge measuring beta amyloid for a long time until they succeeded in developing a PET tracer. The Parkinson's field has the same challenge as us. They are not able to measure alpha-synuclein as a PET tracer. And so, it is a difficult protein and a complex challenge, and this is why we need folks like Tim Miller to work on it.
That's great. Thank you for that. And I'm going to ask you one more since you're up already, and then we'll shift to a couple other presenters. But Joe Winkler would like to understand the difference between Radicava and AMX35, if you could explain that at a high level.
Yeah, so the new drug AMX35, it works on, it's a combination product of two compounds. It's something called sodium phenylbutyrate, which works on protein handling. So exactly the TDP-43 protein that I just talked about, the TDP-43 dysregulates, and sodium phenylbutyrate, which is one half of this product, works on that protein handling pathway. The other half is called taurursodiol, which works on the antioxidant pathway. When cells start to die, they undergo oxidation, and this oxidative stress is what produces more cell death. And so taurursodiol reduces mitochondrial, normalizes mitochondrial dysfunction and works on oxidative stress. Radicava works on oxidative stress as well. Edaravone is an antioxidant. It's hypothesized to work on these antioxidant stress pathways. So Radicava, the drug, works on antioxidant pathway. AMX35 is a combination drug that works on both the protein handling as well as the mitochondrial oxidative stress pathway. So it's a little bit different. It works on two different pathways, unlike Radicava that works on a single pathway. So I hope that biologically makes sense to you.
Thank you, Kuldeep. We appreciate that overview and clarification. I'd like to ask Anna now. Anna, you referenced this. I know you saw this question come in earlier, but you got a question about what it means to be a clinic liaison. Could you expound on that?
Sure. I'd be happy to. So there are, in my presentation, I mentioned that there are currently 5 clinics that are active in our region. And each of us as a representative of ALS Association attends those clinics when they do happen in person. And the purpose for that is, there's quite a few purposes, but it all has to do with coordinating a person's needs and a person's care. So I can speak pretty openly about Washington University's clinic. I attend that when it is in person. And I have the opportunity, sometimes when a person finds out that day at the clinic that they are diagnosed with ALS, I have the opportunity to go in and speak with them right away and talk about the services that we provide, can talk about how coordination of care can happen, can provide resources, can really help the person understand and know that they're not going to have to go through this journey alone. And so each of us as representatives have that partnership with the clinic and work to coordinate services. If the clinician has a recommendation, does it make sense for ALS Association to provide it? Does it make more sense to go through insurance and then the social worker takes that direction? And so it's really designed to try to provide all the needs a person with ALS might have.
Outstanding. Thank you for that answer, and thank you for all you do operate in that capacity. We're at time, but I'm going to ask us if you guys can stick around for just one more question. Anna, I'll leave you up here. I'm going to ask Mark to join you. Gail spoke when she was on screen earlier about Jane's Angel Fund, and this is one of the newer programs of the chapter. And Mark, I know you and Anna are very, very familiar and very well equipped to talk about the program and how it started and how it's used. And so I'd invite you to do that.
Well, let me start, and Anna can put the nuts and bolts on it. As I mentioned early on, the chapter helped my wife and my family for a long time as we went through a journey with ALS. And after my wife passed away, I wanted to give something back to the chapter, and so I talked to the chapter about providing some funding and what kind of meaningful program could we create. So we created the Jane's Angels program, named after my late wife Jane, and that program is set up to provide funding for ordinary, everyday issues and problems not covered by private insurance, Medicare, or Medicaid. So things that insurance, whether it's government or private, doesn't cover, this fund will. It covers almost any other type of issues or needs that you have, and it's been accessed considerably by our patients, so we know there's a need, and it was very gratifying for me to be able to work with the chapter to create such a vehicle to help our patients and their families. And Anna, you can jump in and put some nuts and bolts on it if you unmute yourself.
There we go. Sure, I'd be happy to. This is, you know, the timing of this program was really exciting. Right as I joined the association was right when Mark brought this very generous concept to us, and so I was able to work with Maureen and our team and really create what this program is going to look like. And so we've been able to help many people through this program. What we know is that ALS is a very expensive disease, and it impacts not only the family at the time that the disease is occurring, but it can affect generations to come, because funds that were perhaps going to go toward their children's college fund or savings account is now being utilized for immediate needs, which makes sense. And those are the really tough decisions that people with ALS that we work with are having to make. And so this program has really been able to make an impact on, like Mark said, those everyday ALS, not even always ALS related costs, but certainly those that are impacted by the exorbitant costs that are associated with ALS, with the disease ALS. And so we've been so happy to be able to provide this to the folks we work with.
It's truly a wonderful program. So thank you both for taking a minute to speak about it. And Mark, you in particular, thank you so much for your generosity in establishing that fund. I know that you have made a profound difference in the lives of so many people that are impacted by ALS, and you're a real blessing to our chapter and our community. So thank you again.